It's the 1st of September and it's another lovely day here, so I thought I'd take the opportunity to record the video outside today. Um, Today I thought I would discuss with anybody who's maybe thinking about accessing any type of therapy from a trainee. I thought I would go through that with you. If some people are weighing up their options within this area, then I'm really pleased. I'm glad that you're taking it seriously, because entering into any sort of therapy is really important. And I'm really pleased that you're taking the decision seriously, and you're not taking the decision lightly, and you're weighing up your options. There may be a trainee therapist that's living nearer to you or that's being recommended to you. It may be for financial reasons that you're thinking about seeing a trainee. And so I'm really pleased that you're weighing up, and you're trying to decide whether or not it's right for you. As a trainee therapist myself, I can't give you the answer about whether you should or shouldn't go and see a trainee therapist. What I can do is I can explain my training process. My training is with the Manchester Institute for Psychotherapy, and for my training is a 4-year course. And at the end of that 4 years, what I gain is a diploma in Transactional Analysis Psychotherapy. And in order to complete that diploma, I have my 4 years of taught training, and I also have to have delivered 450 hours of therapy to clients. And during the process, I need to have been in therapy myself throughout the 4 years of training. And also, as soon as I started seeing clients, it was really important that I access my own supervision. And all therapists should be in supervision if they are practicing. And as a trainee, you receive that supervision just a little bit more regularly than someone who has completed their full qualification. Should I want to go on to become a certified transactional analysis, then that route requires me to have completed 750 hours of delivered therapy with clients. And there's also a big case study and an exam to complete at the end of that. And that can often take people anything from 5 to 7 years, sometimes to become a fully certified transactional analysis. So guess what I'm trying to say is that my training process, it's a really thorough training program, and at the end of my second year, you go through what is called a clinical competencies test, and that's done with our lead trainer, and that's when they sign you off and decide whether or not they think that you're able to start seeing clients. So that's my training process. That's what I'm going through. I've done my clinical competencies, and I've been signed off, and I'm practicing now. So that's kind of my training kind of pathway. It's important to note that not all courses have the same training pathway. If you're thinking about seeing a trainee therapist, then please do make sure that you find out what their training process is. Transactional analysis is one of the most in-depth training programs that I think that I've come across, and lots of the different transactional analysis training programs are all slightly different. So if you're considering accessing therapy, then please do a little bit of research, find out who and where the person you're thinking about seeing is training, and ask them. If you have questions, then please ask them. I would hate to think that someone was maybe considering, trying to weigh up whether or not to come and see me as a trainee or not, and they had some questions that they wanted answered and they didn't ask them. So please go ahead and ask them. It's also worth finding out whether they are insured. I have my own private insurance that allows me to practice, and I'm also a member of the governing body of the UK. It's called UCATA, which is the UK Transactional Analysis Association. Okay, so it's just worth, and obviously those I abide by their code and ethics. So it really is worth doing a little bit of research. If the information that you want isn't available, then ask them as a trainee. Another thing that I think I would also advise that you consider or you talk about is find out what their background is, what's their history, what work have they done prior to entering into the training? Has it been in the area? Has it been anything related, or has it been something completely different? It's not always going to make a massive amount of difference, but it might, it might give you an indication of whether this is someone that you might like to work with, and it just gives you a little bit more information about where they've come from and what their background is. In terms of my background, I have worked in mental health and substance misuse services for a number of years now, so I've gained quite a lot of experience within that area. I've done a lot of one-to-one work with clients, I've gained a range of experience in a range of different areas throughout my work there. I also work as a counsellor in a domestic violence and sexual abuse service, so I've also gained some insight and some background knowledge into that sort of area as well. And I guess for me, if you're watching this and wondering whether or not, you want to enter into a therapeutic relationship with me, I'm really passionate about my work. It's something that I've wanted to do for quite some time, and I feel really lucky and privileged to finally be in a position where I'm doing it. I'm enjoying my work. I'm loving the work that I'm doing. All I can say is if you have any questions or you want answers to anything else, then please do contact me. I'd love to hear from you, and I'm more than happy to answer any questions that you may have. So I hope you all have a lovely day. Thanks for listening, and maybe I'll catch up with you soon.